Hey, I'm JW Oliver, joined by my friend Gary Salmon, and we are going to be talking a little bit about in the healthcare, dental specific world about these unprecedented cyber threats. And we're going to do a series here where we're going to cover some different areas. But man, I'm so excited to have Gary here, and we're going to talk about cybersecurity. But Gary, bigger than that, tell me about your recent award, not number two, not number five, but number one out of 40,000 IT companies in North America, and you were voted number one for cybersecurity. That's impressive. Tell me about that.
Yeah, it was a total shocker. We got a call about 8 weeks ago now, and I was told, "Hey, you're flying out to Denver, Colorado to receive an award." And I'm like, "Okay, what award am I winning?" And they said, "You'll kind of find out when you get here." So myself and a couple of the team members from our C-suite flew out to Denver, and we found out we won number one cybersecurity company in North America. And we were up against about 40,000 IT companies and other cyber companies. So it was a no joke award. It's a multi-billion-dollar company that issued this. And we were up on stage with Microsoft, CrowdStrike, Zoom, web conferencing, and a bunch of others. So this was not a little award. So just super proud of my team and everything that our company has done to help secure the digital landscape for thousands of businesses.
Yeah, well, look, I've known you a long time. We've known each other from a previous company as well, and I know how hard you work and the effort you put into it. And you've also assembled a great team. I could go on and on about the team that you've put together, highly qualified, skilled team. So congratulations. That's a huge award. Again, that's not as we know, there's all these pay to play kind of awards, but yeah, I don't think Microsoft was paying to play. Neither was Zoom. So yeah.
No, definitely. It was not a pay to play. So totally, honored and humbled to be up on stage. That was a very cool experience.
Well, congratulations. I really mean that. That's you're a good friend,
Thanks.
and that's cool to see that. But hey, I want to jump into talking about securing patient data. We do a lot of discovery calls with dental offices, large groups, small groups, single offices as well. And I guess I'm just amazed. I'm actually a little shocked and surprised when I'm speaking with, could be the CEO, could be the operations manager, could be the CTO or somebody you're talking to. And they don't really have good things in place, because when you talk about these ever evolving threats around PHI, for you and I talk about ransomware, the phishing attacks, not phishing like phishing, but PHI phishing, and all the regulatory arrangements around HIPAA, et cetera. Talk to me a little bit about this whole threat landscape that we're in, and the securing of, and why is it? It's been a subject, right? But it seems like it's almost like, well, it hasn't happened to me, so I'm not going to worry about it. Is that the theory behind that too?
So I think there's part of that is what people are thinking, right? They're like, oh, it hasn't hit me directly. My T company securing me. They tell me I'm doing cybersecurity with them. But if you actually start talking to people, right? Dental and healthcare professionals, and you ask them a very simple question: do you have a colleague that was impacted by this, a cyber event? And I'll say a majority of them will say, yeah, I know someone, right? They were down for weeks. And if you talk to folks like us, you talk to individuals in law enforcement at the government level, three-letter organizations, everyone's kind of saying the same thing right now. You will have a cyber event at your business, period, right? In the next couple of years. To what extent? That's to be determined. It could be a full-blown ransomware attack. We're seeing a transition now with the threat actors moving towards strictly stealing all of the confidential data and moving away from encrypting the machines with ransomware. Because, if you have good antivirus software, the second they start encrypting the machines, that antivirus software may trigger and send an alert to responding teams, and they may or may not be able to stop the event. So if they just steal your data, they basically walk into your house, they steal everything without tripping the alarm system and walk out. And then you come home that night and you're in an empty house, right? They got everything. And in fact, JW, the last a handful of incident response cases that we've handled. So we get hired by like law firms and insurance carriers to do these types of events. These events were all strictly data exfiltration and no sensors in the environment triggered. And the first indication that the business had was a phone call from a threat actor saying, "Hey, I am John Smith from XYZ ransomware gang, and I stole all your data." And typically the business executives are like, "It's just a scam phone call," until it starts escalating. And then they quickly realize we have a major problem. Like, they got all of our data, all of our confidential protected health information, PHI, and now they're in crisis mode.
So let me ask you real quick. So to simplify my small brain here, so it's like
yeah,
you left your house. You had your alarm on in your house. You
yeah,
had your perimeter uh, all secured, the doors, the windows, etc. But it's like somebody came in through the floor of your house, ripped you off completely, took all of your jewelry, all your money, everything, went back down that hole, and when they left, your alarm was still on. Is that a
the
fair
alarm was still
assessment?
on.
Wow.
Yeah, your dog was still sleeping. Your cameras didn't pick it up, and no response from the police because your alarm didn't trip. So, and that's exactly what we're seeing, right? And I think there's some strategic mistakes that organizations are making, and we'll talk about this in a little bit more detail. And the strategic mistake that I see is almost every healthcare organization is playing defense, and that's exactly like you described. That alarm system that's going to trigger when something bad's happening. But what I'm seeing now is the alarm systems aren't enough, right? You have to figure out, hey, how do I put rebar and concrete in my floor so no one cuts a hole in
Yeah.
my floor and climbs in, right? And I think that's where cybersecurity companies can really help. They specialize in this stuff, and they can say, okay, that's cool. You're currently doing X, Y, Z, but that's not going to cut it anymore. That's not going to keep you secure.
So let me stay in that same frame. So you would be like a building contractor who I come over and say, "Hey, Gary, come take a look at my house. I've got this alarm system. I've had it for 4 or 5 years. Seems to be working okay. Can you just give me an assessment of my house where I'm vulnerable?" And you go, "Oh, okay. Well, you got two holes in your floor. You've got a vent, and wide open gape in your
Right.
soffit in your roof. They can get in there. So you think you're protected, but really, maybe for the average criminal wanting to break in your front door or come through a window, you're probably okay. But for a high tech, seasoned thief, you're probably not very well protected."
Yeah, for sure. Right. And this is a really good example of it. So from a digital perspective, hackers break in either through tricking your people, right? People using computers, including the doctors. So they get that email, it's a phishing or spear phishing email, and they click on something and they download a malicious payload that allows the hacker to get in. Or kind of like you're describing, JW, is they scan the firewalls, they scan the computers, they look for vulnerabilities. So a vulnerability is very much like you just described. It's that vent in the roof that has no sensors on it, and you climb through that vent in the roof, and boom, you're right in the vault room, and all of a sudden you don't even need to pick the lock on the vault. You just take everything out of the vault and leave and drive your car out of the driveway, and no one knows what happened until someone opens the vault.
So
Or the police notify you that your stuff was just stolen because they pulled over a car. Right? I mean, that's conceptually what's happening.
So Black Talon is obviously way out in front of this in terms of utilization of some AI tools, utilization of some very high tech software. And by the way, we at ZimWorks support DDS. I don't know, we've been clients for coming on probably 5 years, I bet. And
Yep.
we actually actively monitor now over 1,500 computers, workstations through on 4 different countries, and actively monitoring the work that we're doing. What is it that you're doing different that let me just use an example.
Yeah.
Let's say I'm running my business and I'm like, "Hey, Gary, great. It's great that you want to protect my dental office, but you know what? I'm using XYZ IT company, and uh, they've assured me that they've got good protections on my firewall." Rather than just saying, "Well, they probably don't," what is it that
hmm
you do to maybe review, analyze a system to see if they really do or not?
Yeah, so there is some amazing technology that we leverage. The technology that we use, believe it or not, you're typically going to find in Fortune 100 companies, right? This is the same stuff multi-billion-dollar companies are running, because we have 50,000 plus computers running this technology. We can take this very expensive technology and allow small businesses to leverage it. So basically, what we're doing is we are testing the resilience of your devices to a cyber attack. So hackers will breach a firewall because it's misconfigured, right? So a lot of doctors say, well, I just bought $1,000 Cisco firewall. I'm fine. And my response will be like, okay, that's great. How do you know that device is configured properly? And then I get I don't know, I just pay someone to do it and they do it. So what our technology does, JW, is every single day we hit that firewall and we say, hey, are all your doors locked properly on you, on you, Mr. Cisco firewall? And the answer may be yes, like, hey, we're hitting it, we're attacking it, it's not responding, so that's great, it's blocking everything. Or we may get a response, oh, this door is wide open and we have access to your login credentials for your firewall. Or we can see your security cameras. Or guess what? There's a vulnerability there that allows us to log into your firewall without a username and password, right? Because the software is buggy, right? It's got a vulnerability on it. So these types of tools can ferret out all of those scenarios that I just described, and typically, we don't ever really see IT companies that have this technology. And this is how hackers are breaking in, right? I tell every doctor and executive, if you pulled your firewall logs and analyzed them, you would be horrified, right? You are getting hit hundreds of times per day because the hackers will scan millions of IP addresses over the course of a couple days looking for a misconfigured firewall, looking for something exposed. And a lot of times dental groups, they get hit not because they were targeted directly. Yes, that does occur, but more likely because their technology was misconfigured, right? That patch wasn't applied. We did a ransomware attack for a group just recently where the IT company just made an honest mistake. They let the license expire on the firewall. The firewall wasn't receiving the security patches from the firewall manufacturer. The hackers scanned the internet, found their firewall. Their technology said, oh, it's missing this patch. Use this hacking tool. They use that
Wow.
hacking tool and they get right into the server. Like it's almost out of the movies, but that's how this stuff is working. So that type of technology does it. I'll say simplistically, but there's a lot of horsepower behind that. And then on the inside of the network, we hear this all the time. We hear business owners and doctors, right, and executives saying, well, our IT resources are patching our computers. Okay, how do you know that? So our technology scans the computers and servers every 4 hours, looking to see if there are vulnerabilities on these computers that hackers can use to exploit their technology. And it's shocking, right? We'll get into a network with our technology and go back to the doctor and say, hey, are you paying for patching with your IT vendor? Oh, yeah, we pay that every month. You haven't had security updates from Microsoft in 3 years.
Wow.
And it's just like, and then it's that gut punch where you realize, okay, what's going on here, right? And this is why so many law firms, right? And some of these law firms, right? I'm up on stage with saying, like, look, you got to separate IT from security because you have to have the IT company doing what they do great, right? You have to have a good IT company to keep the computers up and running, fix things when they break, bring in new technology. But you need a third party to come in and really test the technology. You need someone who specializes in this and has the right tools. And that's the problem. Anyone can say they do cybersecurity. You can hang that shingle on your website all day long, but it takes credentialed people and tools.
Well, and first of all, and just confirming with you, I don't think this has changed. You're not an IT company, right? I mean, I
We're
think
not.
be clear
We're
about that.
not.
Yeah,
Yeah, we're not.
you don't do IT work. I think that's the difference. And I mean, and I'm sitting here looking at we do, and we've got some, part of our company has some IT support we work with now, and I'm just thinking I don't want to be in the cybersecurity business. Matter of fact, I don't I don't even want to be liable for that, right? I mean, so I would think most IT companies, it's kind of like operating in your own sphere of expertise, right?
Right.
when you try to do too many things. I'm not saying there's big companies that maybe could do both, but in general, would you say most IT companies, MSPs, whatnot, that are supporting in the dental world anyway, should really be separating those services? I would think that just seems like a smart way of doing things.
I mean, I think it is. You gotta know where your limits are and what your capabilities are, and I think a lot of times what we see in the MSP world is the Kool-Aid drinking. Right? They go to a conference, they see, oh, check out this new antivirus software. It's gonna stop anything and everything. They throw it on a network, and there's an event. Well, it wasn't configured properly. You have people who aren't trained properly, right? They dial back the technology because they don't want to deal with the support phone calls when something doesn't work, and they just don't have the experiences. And this is a problem, right? We know that any technology is beatable, right? The hackers have the capability of beating just about anything. The question is, how do you prevent them from getting in your house so that we don't even have to worry about that? And that's our philosophy. It's like, how do we lock down the environment so well that the business can still function fine, but they're not even getting through your front door, right? So that German Shepherd isn't even going to need to attack them, right? And
Yeah.
and that's where cybersecurity companies really specialize in. Like, let's harden this environment, find out what's wrong with it, get rid of these risks and these vulnerabilities, and then we have backup, right? Which means even if we did everything right, someone could still beat it. And if they get in, then you're going to rely on some type of AI to detect an intrusion and react autonomously and call for help. And that's where the cybersecurity world is at right now, right? Multi-layer defense.
So kind of to wrap this session up, I just thought of another analogy. Sorry for all these home building contractor analogy, but it's a little bit like if you needed brain surgery, right? And you
Yep.
said, I've got this brain surgery that I need, or maybe I've got to use something more simple. I've got an ACL that needs repaired. Would you just ask your general physician, say, hey, can, could you just fix my ACL because I really don't want to go to the orthopedic surgeon? It's going to be a lot more expensive, or I got to go to another doctor, or I got to look at something else. To me, it's the same thing. You're finding somebody who's specialized in one certain aspect of it, and I think that's important. But what can somebody do? What are a couple of things? I mean, I get you get the texting. I've got the bank apps that give me different passcodes and whatnot.
Right.
What are two or three things that you should be doing to protect your data?
Yeah, look, I think there's the basic stuff that you have to do, and then there are the things that you really need to do to try and protect your patient data. So the basic stuff, very simple. Multi-factor authentication, right? So you can do that through text messaging, which we really don't recommend anymore, where like the bank sends you a text message, and then you punch it into the website or the app. You can use authenticator apps in lieu of the SMS. So like Google Authenticator pops up and it, has you do a fingerprint or punch in a code, something like that. Any of the authenticator apps are great. You should use a password manager, right? So the password manager creates a unique username password for every single website and application you use. The nice thing about password managers that a lot of people don't realize is if you get a phishing email and it directs you to a website that looks like Microsoft, and the password manager detects that, which it won't put your username and password into that login screen. And instantly, you should pause, be like, whoa, what the hell? I thought I was
At
logging
Chase
into
Bank,
Microsoft
I log
365.
into Chase Bank all the time. What's going on here?
Yeah.
Yeah.
Yeah. Like, why didn't my password get inserted? And then you look carefully at the URL, the web address, and it's like Chase Bank 123, banking.com, right?
Yeah.
It's a fake web address, and the password manager saved your butt.
Yeah.
So I think those are really important. I think you should have other things for your business like vulnerability management, right? As I alluded to, hackers break in through vulnerabilities all the time. When we do these forensics investigations, it is very clear in almost every case. And if you look at what the FBI is saying and Homeland Security, they're all now pushing for businesses to manage vulnerabilities through vulnerability management tools, right? So that's kind of what I talked about. You got to have that penetration testing. That's where ethical hackers from a cyber company try and break in and expose your weaknesses in your environment. So you have to do pen testing. You have to do training. You know how many unfortunate cyber events that result in millions of dollars are because a doctor clicked on a link and gave hackers access to his or her network? Like that's a really tough pill to swallow when you're, an executive or owner of a business that you caused the event. I won't say 100% preventable, but highly preventable. Email security, right? This is a relatively new technology that we're really pushing into our clients. This will use AI to actually read all of your inbound emails. And the AI engine is really, really good at determining whether the email is legit or not. It looks at the links, it looks at the attachments, it reads the email, and it instantly flags it or actually doesn't even deliver it to your inbox if it knows definitively that it's malicious. Like, these are all tools that are not expensive, but are highly, highly effective. And then, one of the things that we've been doing, and we do it for ZimWorks, is we present a cyber risk rating, right?
Yep.
So as the owner of a business, you could say, I don't understand anything about security, right? But what's my cyber risk score out of 100? Like, kind of like a FICO score for credit. And you can look at that and be like, oh, we're only a 5 out of 100. We're kicking butt with Black Talon, or we just onboarded with Black Talon and our cyber risk ratings of 70. We got some major work to do here to secure our environment. And then you monitor that on a weekly or monthly basis. And it's a great way of having a good idea of how you're doing from a security and compliance perspective, right? God forbid you have an event and OCR, the investigative branch for health and human services, think HIPAA, comes in and you have all this historical data about all the things you've been doing to secure your environment. They're going to look at you very differently than a practice that says, I don't know what we were doing before this event. I'm sorry.
Yeah. Or my brother-in-law manages this. Let me ask him. Yeah. Yeah. Very, very bad, poor answers. Yeah. And look, I'm speaking from using, being a client as well. The training that we're able to get, which I think we're going to talk about in the next episode we do, is talking about what are some of those practical things we can do, whether it be training or whether it be some different software like email software you mentioned. And again, a lot of those things are very inexpensive things as well. So,
Right.
Gary, this has been great. I think just using that housing analogy has been very good for me to see it that, oh, yeah, my alarm didn't go off, but I still have some problems.
For sure. Yep, absolutely.
All right, Gary, thanks, man. Good to see you as always. And look forward to catching up with you on the next one.
Thanks, JW. Appreciate having me on board.
You bet.